Each year, Mount Sinai honors a select number of outstanding alumni and faculty members whose careers exemplify the highest ideals of the Mount Sinai health system. They have made incredible contributions in clinical care, biomedical science, and medical education. They've given extraordinary service and leadership to the health system, Icahn School of Medicine at Mount Sinai, and the Alumni Association. These are colleagues who personify excellence in the Mount Sinai tradition. This year's Jacobi Medallion honorees include a lead educator in OBGYN, an expert in the fields of neuroscience and drug addiction, a renowned specialist in anesthesia for otolaryngologic surgery, invasive pulmonology, and the management of difficult airways, an esteemed clinical educator and infectious disease specialist, and an expert with decades of experience in bioethics. With the Jacobi Medallion, we honor their achievements and we express our appreciation for their important roles in making the Mount Sinai Health System one of the nation's leading academic medical centers.
At its core, obstetrics is about bringing life into this world. And I always say to the students, who's the baby's first doctor? Some of them say pediatrician, but in reality, the baby's first doctor, the one who lays their hands on the baby, are the OBGYNs. That's the exciting part of our field, I think, is that we're there at the beginnings of life. I really do love obstetrics, and I hope that the residents and fellows, when they see me and how I teach, can emulate that.
Kathy Chen is a leader in OBGYN education. She helps oversee 7 OBGYN fellowship programs and 5 OBGYN residency programs at the Mount Sinai Health System. She also directs the Icahn School's OBGYN clerkship and elective, and has taught approximately 2,100 students since 2009.
I think it's just exciting to be with young people who want to learn. And I want to show them the fun parts of it, the exciting parts, the intriguing aspects of it.
Kathy's role as Vice Chair for Education is so important because it's because of her that we keep residency programs going and growing, fellowships going and growing, and also keeping the cycle of medical students being interested in going into OBGYN.
I think of myself as a guide, a shepherd, an advisor. I just want to make sure that a learner has the best environment to learn what they're supposed to learn. I will do what I need to do to improve the experience for my learners. I will find the way.
The biggest thing that Kathy Chen did was, by the power of her commitment and passion and leadership skills, by her force of will, she got people to pay attention to the students and residents and really commit to teaching them. Not to think of residents and students as tag-alongs, but as to treat them and give them actually a curriculum and a place on the team. She will fight to the death for her programs.
She embodies exactly what the medallion represents, which is excellence in medical education, in patient care, and in innovation. And she does this in a way that really helps move forward the medical students to achieve the highest level of success.
The Jacobi Award, what it's recognizing in me, it's how important education is. That being an effective teacher is crucial also to Sinai, and also crucial to the future of medicine.
I grew up with a front row seat to addiction. I saw it firsthand. We were immersed in an environment, a community that was ravaged by drug addiction. I just didn't realize that there was a science behind it and that you could potentially work on this, understand it, and intervene. That's really where I saw myself moving forward as a scientist. I could be a person to help change what it is that I saw firsthand.
Paul Kenny is a leading expert in the fields of neuroscience and addiction, with a focus on understanding the molecular neurobiology of drug addiction, obesity, and schizophrenia. His research seeks to uncover the adaptive mechanisms in the brain that drive addiction and other compulsive behaviors.
We identified him years ago as a rising star in the field of neuroscience, building our neuroscience community at Mount Sinai into truly one of the best neuroscience research enterprises in the entire world.
At Mount Sinai, I've got 3 real functions. The first is I'm a principal investigator. I'm an independent scientist. I have a lab of trainees, and my goal is to try and understand the brain in the context of substance use disorders.
He's probably one of the top addiction researchers in the world right now. Paul was one of the first labs to really show that nicotine, for example, can activate brain circuits that ultimately influence our peripheral organ systems, including the pancreas. His research has actually implicated smoking in the development of type 2 diabetes.
The other hat I wear is I'm the director of the Drug Discovery Institute. And so that's really trying to take the most interesting findings from labs like mine and other labs here at Mount Sinai and drive those findings into new medications.
Paul is one of very few people who can traverse that territory, from basic research on addiction mechanisms to making a new medication that can be given to people with an addiction syndrome.
Another job I have is chair of the Department of Neuroscience.
The question of what is it that Paul brings that elevates the faculty here in neuroscience. He's one of these people that has contributed so much to the field. And I think we all look at that and it makes us better scientists ourselves. We look to him sometimes for those ideas that might push our own research programs forward.
By honoring Paul Kenny with the Jacobi Medallion, we are recognizing someone who has made seminal contributions to neuroscience research, someone who has been a spectacular department chair in building a world-class department at Mount Sinai, someone who is a spectacular leader and great human being.
I feel tremendous urgency about the work I'm engaged in, and I think the clock is ticking ever louder in my ear. I want to have an impact, and I feel I'm in an environment where I can accomplish that, and I will accomplish that.
It's definitely a source of pride for me to be one of few anesthesiologists recognized for our overwhelming contribution to the institution, to the mentorship of the next generation of physicians. It really is monumental to not only watch the growth of all of the students as they become practicing anesthesiologists. It really has been my dream job to be part of their careers and watching them become superb doctors and physicians and anesthesiologists. Winning this award says that being a teacher and an educator and a mentor means something at Mount Sinai.
Adam Levine is a renowned expert in anesthesia for ENT surgery, invasive pulmonology, and the management of difficult airways. He is also a pioneer in healthcare, simulation education, and assessment. He has held several prominent roles within our institution and has been program director for the core anesthesiology residency program since 1996.
I'm the longest running program director for anesthesiology in the country. So I'm proud to say, and I don't think this is hyperbolic, that I've been responsible for the oversight, the training, and the education of more anesthesiologists than any other person in the country.
He is the embodiment of what you want a program director to be. The way that Adam teaches, it's like the spectacle to be seen.
Chest compressions, or did you, as soon as you get shock? I love it. So you get that, you defibrillate.
The way that he is able to integrate not just physiologic knowledge, but get into the perspective or the mindset of the learners, almost as if he can anticipate the questions that they're going to be asking.
Think about your role. You're saving people. The only way they're being saved from the pain, the torture, the anxiety, or their life or their limb is you guys are the first stopgap.
There's a reason why people continue to want to come to our program, stay in our program, and stay at our institution, and Adam is one of the main reasons why.
He has been at the forefront of simulation education, and he has really brought that to the fore in his field.
The whole idea behind high-fidelity simulation is that you enrapture the learner and you bring them in. And Adam was integral to bring the simulator to Mount Sinai. We were the beta test site for the first comprehensive human patient simulator.
Why does he deserve the Jacobi? He has elevated our school, our hospitals, and our students, and he has worked so wonderfully for our patients. He's elevated us, which is what the Jacobi is about.
Mount Sinai was the place I wanted to be a student and where I wanted to do my residency and where I wanted to stay as my career. The most important thing I can contribute is being that superb role model and really allowing the residents and the medical students to model my enthusiasm for medicine, inspiring them to put the hard work in to being the best doctors they can possibly be on behalf of their patients, to recognize that this isn't just a job.
Working with students is extraordinarily rewarding. They are all here in medicine at Sinai because they want to make a difference. They want to spend their lives taking care of patients, innovating, doing cutting-edge research, cutting-edge clinical work. All the work that they're going to do is the next generation of physicians, and we have a small part in bringing them in, educating them, and supporting them.
What first comes to mind when you're thinking of Dr. Parkas is admissions, but she's so much more than the Dean of Admissions or just being associated with admissions. She's a mentor, she's an advocate, she's a guiding force for so many students here.
Valerie Parkas is an esteemed clinical educator and infectious disease specialist and has dedicated her career to fostering innovation in medical education and admissions. She has been a driving force behind transformative initiatives in medical school admissions, including the development of the FlexMed Early Assurance Program and a pioneering institutional partnership for military veterans.
She has really framed who we are as a school and has directed our admissions process to be one that is forward-thinking, innovative, and one that will take us into the 21st century.
This is a mission-aligned and mission-driven healthcare system, and it all starts with the medical students.
She is considered a national leader in medical school admissions for much of the work she has done in developing really a holistic and inclusive admissions process.
I think that it's extraordinarily important to think about attributes that folks have that they can bring to medicine. So an example of that is bringing folks in who have a background in the military.
For me, transitioning from the military to medicine came with its own unique challenges. There was a ton of uncertainty. Would I be a good fit? Do my experiences translate well? And something I appreciate Dr. Parkas for is, from the very beginning, she was very clear that while excellence was absolutely an expectation, she helped me realize that my past experiences weren't just relevant, but an asset.
I feel deeply connected to every student that we admit and who comes to our school. I feel that each one belongs at the school.
She's someone who's changed the paradigm of medical school admissions, and in so doing has impacted the lives and careers of probably thousands.
By honoring Dr. Valerie Parkas, we are honoring an individual who has influenced a generation of students. Dr. Parkas has been a bridge between two worlds for me, coming from the military into medicine. And I would not be the person I am today without her influence.
Receiving the Jacobi Medallion feels in some ways unbelievable because I think that one always feels that one has to do more and do better. In the end, who we're teaching and what we're teaching is critical to the workforce of healthcare and medicine and the communities that we serve. And what could be more fulfilling?
I have a perspective on medical ethics and bioethics that many people do not have. I can see the landscape of how the ethics of medicine, the various pieces of it fit together that make the practice of medicine possible and that allow patients and society to trust what we do and to come to Mount Sinai and feel that this is a trustworthy institution.
Rosamond Rhodes has decades of experience in bioethics and specializes in the ethical challenges of healthcare, clinical practice, and public health. Since joining our faculty in 1998, Dr. Rhodes has been instrumental in integrating bioethics into medical education.
She has taken Sinai to a higher stage, a higher platform of recognition in bioethics.
I think it's really important that we as physicians and scientists hear the voice of someone who comes from a very different discipline.
I see myself as a philosopher. It's the philosopher's inclination to always be pressing people for a reason for the position. We shouldn't be making decisions based on gut feelings.
Often we have to make decisions that are time sensitive, and so we need to be prepared for those moments. We need to be prepared for those situations. Rosamond's gift is that she helps each of us find our own moral compass.
A big part of the decisions in clinical ethics consultation is about what are the facts, what are the medical reasons, what's going on medically, will this provide a medical benefit for the patient? Those are things I can help explain to students, certainly in clinical ethics consultation.
If you really listened to her, you do a better job. The patient is better cared for. It's not organic chemistry. It's not physical examination or laboratory tests. It's a test of the integrity of what you are doing as a physician.
I hope to instill in the students an understanding of a career in medicine is a serious moral responsibility, and they have to think about what is the right thing to do for my patient.
Her role really has had an impact on all of our academic missions here.
Getting an honor, the Jacobi Award from Mount Sinai, is quite remarkable to me because it shows that my peers in the institution have valued my voice, my contribution. It's very, very moving. It's been a wonderful journey.